This was a good demonstration of communication, and the observation felt like a conversation rather than a very didactic delivery of information. The patient's concerns here are paramount, and they were ascertained early and dealt with in a very structured way, and both the mechanism of how a heart attack happens and then the mechanism of action of the individual drugs were explained in a very non-jargon layperson's language. At various points, the candidate gained acknowledgement that the patient understood. He was realistic about the fact that the majority of the medications were lifelong. However, there may be some dual antiplatelet therapy which is rationalised after 12 months following stent placement. This scenario involved having some knowledge of the DVLA guidance on driving, as many of the communication encounters do. It is worth looking at the common conditions that may arise in the communication encounters, such as myocardial infarction, cerebrovascular disease, epilepsy, and obstructive sleep apnea, and reviewing the DVLA website so that you have some of the knowledge required. Whilst it is okay to say you will refer to the guidelines, some basic knowledge will look professional. The candidate used summaries well, and this can be used at different intervals when imparting a lot of information, allowing a steady build-up or layering of information. The important aspects of cardiac rehab, diet, smoking, and secondary prevention medication was handled well. Exertion post-MI and sexual activity was raised by the patient and answered well by the candidate.